Until earlier, we used to talk about computerization. Pehle, we used to build a hospital banado. You give the staff, you give the people. But later on, we said you should have a HMIS, companies who could come and provide your service. The TCSs, the Infosys, the Wipro and others. With AI coming in, there has been democratization of innovation. And there are all these wonderful small startups coming from educational institutions, innovative and entrepreneurial youngsters who are building these solutions by using AI in a very intelligent manner. And their procurement becomes a very big challenge. You can't write a manual to procure a particular solution simply because the pace at which it is changing. And challenges like these and the policies that the government of Andhra Pradesh has brought in have actually shown the way how AI solutions can actually be institution procured, developed, procured, and institutionalized. So this BedTech challenge is a culmination of that effort, and I really congratulate the state government for being able to do this, and also thank the honorable minister for the guidance is provided in taking this forward along to make this possible. So after having done ABDM, after looking at what is possible, the next stage is how do we make sure that this vast amount of data we are creating is available? And Prakhar has already talked about using data for furthering or improving AI solutions further. So this is where the next challenge, and this is again I'm offering or talking to telling the state here, is ABDM was about personal data. It was about continuum of care at an individual level. It was about consent management at an individual level. But if you want to do secondary data analysis, if you want to train an algorithm, you need a bunch of data. So the traditional system will not work. So that is why we are now moving towards a health data network for secondary usage, plus a federated learning network where algorithms come to data rather than data going to the algorithm. So that, because it's health, you can't keep distributing health data no matter how much we try to anonymize. So the next level and the next thing that the government can take up and this is something in the next 2-3 months. In fact, the NHA will be launching a secure data environment where the PMJY data will be made available for anybody who wants to try their algorithms, test their AI solutions. And AP can in fact be a pioneer state in taking this kind of factoring and remote care. And the scale, and I really also congratulate all the winners who will be announced shortly by the Honorable Minister for their wonderful solutions. And we will definitely take up this model, take up the procurement system for GOs that the government has issued, take up the model that the government of Andhra Pradesh has followed to other states so that they can make use of these solutions. And you will definitely get calls from other states as to how you do it. Also, the winners may be even called to the other states to implement their solutions in other states. Thank you very much for calling us to making a part of as a part of this, and really look forward to many more innovations from this wonderful sunrise state of Andhra Pradesh. Thank you so much.
Thank you, sir. Thank you so much. We have taken the permission of Honorable Minister for Health and Family Welfare, Sri Satya Kumar Yadav Garu, earlier. Now I request the technical team to please present the ABI of MedTech Innovation Challenge that has conducted India's largest MedTech pilot deployment program. ABI, please.
20% of the world's disease burden. Yet, our rural hospitals face an 80% specialist shortage. That gap cannot be closed by training more physicians alone. It will be closed by intelligent systems that amplify every clinical encounter. Introducing the MedTech Innovation Challenge, a structured bridge between discovery and deployment. Under the leadership of the Honorable Chief Minister, Shri N. Chandrababu Naidu, and Honorable Minister for Health, Shri Satya Kumar Yadav, the Health Department of Andhra Pradesh launched AP MedTech Innovation Challenge. From 200 applications, 18 breakthrough solutions were shortlisted for live deployment across 14 districts. Category A, revolutionizing diagnostics and screening at the front line. Awasra AI makes respiratory health accessible to everyone, using just a smartphone to analyze cough sounds. Pandan AI brings medical-grade ECG diagnostics to the palm of a health worker's hand. Category B, Advanced Lab Diagnostics, brought to the point of care. Remigio enables comprehensive eye screening at remote locations, integrated with the Ayushman Bharat digital mission. Category C, Enhancing Clinical Intelligence and Patient Support System. Easy translates complex physiotherapy data into actionable insights for faster recovery. Analytics digitizes case sheets and automates consultation workflows for seamless care. Category D, Advanced Monitoring and Therapeutics for a healthier state. Rhythm enables real-time remote monitoring, ensuring patient safety even beyond the ICU. These solutions are not just ideas. They are live, deployed, and saving lives of citizens across Andhra Pradesh. We are bridging the gap, strengthening innovation capacity, and creating a replicable model for the world. What began as a challenge has now become a movement of transformation.
Thank you so much for giving a big round of applause. Right. Ladies and gentlemen, taking forward the vision of the visionary leader, Honorable Chief Minister of Andhra Pradesh, Sri Nara Chandrababu Naidu Garu, in each and every aspect of the Health and Family Welfare Department, following every word and concern of Honorable CM Sir, Sri Satyakumar Yadav Garu, being the Health Minister, has involved in many innovative ideas that enhance the elegance of this entire Medical, Health and Family Welfare Department, Government of Andhra Pradesh. Put your hands together and welcome today's Chief Guest, Honorable Minister for Health, Family Welfare Department, Government of Andhra Pradesh, Sri Satyakumar Yadav Garu, to please come forward and give his valuable message.
IPL season, perhaps that's the reason why Kiran Gopal Garu has taken my name as Surya Kumari. But I see there is a euphoria, IPL euphoria everywhere. And here I see the technology euphoria in this hall. The Principal Secretary, Minister of Health, Family Welfare and Medical Education, Saurabh Gaur Garu, the Joint Secretary, National Health Authority, Kiran Gopal Garu, Commissioner Health, Veerapandian Garu, Director Secondary Health, Chakradhar Babu Garu, DPH, Dr. Padmavati Garu, Sivakumar Garu, Dr. Raghunandan Garu, and innovators, rather I would say the brains fostering the cause of artificial intelligence, and friends from media, other dignitaries, Andarki Namaskaram. Today is a very memorable day for the Ministry of Health of Andhra Pradesh for the MedTech Innovation Challenge, which was started a few months back, has reached a grand finale today. It is also a day of significance with the successful MedTech Challenge outcomes. The Andhra Pradesh has become a pilot for National AI Health Mission. We are the first state of its kind to have such a MedTech challenge and unmatched deployment of tools, patient interactions, and evidence generation. I take this opportunity and on behalf of my team, Saurabhji, and I'm not tech savvy, but Saurabhji is tech savvy. I'm not tech savvy, but all the dignitaries and players are tech savvy, that have fulfilled a national responsibility. A national responsibility of integrating artificial intelligence for better quality healthcare services delivery. We have become a lighthouse now. Just now, Kiran Gopal garu was sharing with me. They were clueless of framing guidelines or coming out with an action plan with regard to integration of AI in different walks of life. Then that way I can say with this tech challenge outcome, we have become a lighthouse for the entire nation. With many solutions, many tools, tried, tested and trusted POCs. Now the job of government of India becomes easy that these things can be scalable in other parts of the country, more particularly the poorer states and those states which suffering from the geographical challenges. Friends, the AI emerged as a consequential tool for transformation of public life. Consequential tool for transformation of public life. Now, the AI, we have seen the results also, we have seen the tangible outcomes, how it can improve the healthcare. We have a proven examples in front of us. But if you are not in the forefront in integrating or adopting technologies, emerging technologies, more particularly AI and other things, you are tend to fall behind, left behind. But thanks to the visible leadership, both at the national level, in the form of Prime Minister, who is always taken adapting technology for betterment of every walk of the life. Like maybe it is like bringing in national AI strategy in 2018 or in 2024 SAHI strategic AI for healthcare in India in 2024. We have seen his visionary leadership and needless to say that in Andhra Pradesh, we have a visionary leader who is not only quick in adopting technologies, but also quick in predicting technologies much ahead. And as a result, we have a classic example of, and he also prepares a ground. He predicts it a month ahead, maybe a decade or so, and prepares a ground. When it becomes a reality, then Andhra will be first state to adapt it. That's the reason why we have Google data center here, Reliance data center here, and quantum computing also. And no other state is in a position to compete with us when it comes to adoption of technology. Recently, we had an opportunity to visit Singapore to study certain things. And when there was a session on AI, adoption of AI and other things, the speaker started saying, oh, you come from India, you have a leader who is already tech savvy. And why do you have to come to all the way to Singapore to learn technology here? I said, my leader is, of course, I do agree, is tech savvy, is much ahead, but he must have thought that we are not matching his vision. That's why he has sent us to Singapore to learn something, at least something a little. That is the leadership that we have both at the center and state. I used to wonder because without any technological background, I'm a political science student. I used to wonder what is artificial intelligence is when all people were talking about it. AI is a human only. It is a human in the form of mission, but with more accuracy, precision, and fostered by brilliant time. So if you make use of this technology in everyday life, we can create miracles. That is what happening in Andhra Pradesh by having this Medtech innovation challenge. Perhaps keeping this in mind, the government of India is also focusing integrating AI in the key areas like agriculture, health comes first, health, agriculture, education, smart cities, and smart mobility for economic growth and also social development. But we need to have a proper guidelines and also a framework. And I'm sure today's deliberations, exchange of ideas, will result in such guidelines and action plan also to take it further for the betterment of the human life. Andhra Pradesh in the past 2 years, when I talk generally about healthcare in Andhra, the healthcare services have gone up. Public positive perception is also gone up. RTGS CEO Prakarji here, sorry I missed his name. And the sense of confidence among the public towards government health facilities is also gone up. And it is evident from the OP services that have gone up by almost 20%, more particularly in secondary health by 23%. And proportionately, IP services have gone up, and the diagnostic tests have gone up by OP 60-70%. There's a lot of improvement in healthcare. The infrastructure needs are being taken care of. The HR needs are also being taken care of by fresh recruitments. Diagnostic equipment is being provided. But still, the Honorable CM is not happy, always keep telling us, bring down Satya, budget tagichala, budget tagichala, sir. Sir, services perugutunayi, OP service, run services perugutunayi. The more, the better services you provide in health facilities, the OP services and other services, footfall is tend to go up. It is being, it's going up. But he wants us to bring down the budget the kitchen. Added to that, recently has taken up a population management, also increased the present TFR to 1.5 to 2.1, increase the population of Andhra Pradesh. The more population means the more budget. मनुष्य ఎంత పెరిగితే అంత పిండి పెరగాల. जितना आदमी उतना आटा आटा बढ़ना चाहिए. लेकिन सीएम साहब कहते रहते आटा कम करो, बजट कम करो. कैसा करना है, क्या करना है? Then he comes up with idea again. You pose any question, he is ready with the solution. Then he said, go for AI, integration of AI. That's how all this, like Shivkumar ji was explaining how it began, how it started 2 years ago. That's how that led to this Medtech Innovation Challenge. Almost 297, we have just seen 297 applications and rigorous evaluation procedure by the Committee on Applied Technologies, the members being from IDA, Chennai, ICMR, and other subject expertise. Rigorous evaluation, finally, 18 solutions have been identified and taken on a pilot basis in 14 districts and 40 health facilities, not confining to only primary health. It was done in healthcare, in secondary and also tertiary, not confining to only urban areas. It was done in rural areas also, not confining to only cities or somewhere. It is done in tribal areas and also interior places, areas of villages of coastal and Rayalaseema district. This pilot has been done and we have seen the tangible outcomes of. We have just seen respiratory screening, cardiac screening, cervical cancer screening, and diabetic complications, the management tools, and the AI ophthalmic AI. Many such tools, 18 tools have identified and they have proven that we have seen the tangible outcome. Now we are going to scale up to the entire state, and it is I really compliment the team for organizing such a beautiful event today and the appreciating the winners and also giving them rewards or awards. Some monetary reward is also being given, I am told. This is the thing. Then need to budget, bring down budget. Yes, they started trying it, and added to those, there has to be scale. And apart from this, the CM has come up with citizen-centric healthcare solutions, Sanjeevani, a digital platform called Sanjeevani, with the collaboration of Tata MD and also Gates Foundation. A place where you provide citizen-centric healthcare. I was just talking about we have improved services, we have achieved this. But if someone asks me, okay, are you happy with the performance in the last 2 years? I would say definitely no. Of course, we have come a long way because we inherited a healthcare system, a destructive healthcare system. I don't want to go into politics, but everything was destroyed. The tsunami normally, it was like a tsunami. Tsunami normally comes for few hours, but unfortunately, this state has seen a tsunami that lasted for 5 years between 2019 and 24 that destroyed everything. Now it is like a rebuilding everything after a tsunami that is being done, but with the integration of AI and being with a limited financial constraints, with a limited resources. Now with the integration of AI, with the help of AI tools, we are trying to build the India now. The MedTech challenge is also supporting the four pillars that we are focusing on presently. That is on maternity health and child health and primary health and communicable diseases, non-communicable diseases. Non-communicable diseases are posing a biggest challenge these days. Earlier it used to be communicable diseases. Now it's non-communicable diseases. Now we are focusing on bringing down the prevalence of non-communicable diseases, bringing down the disease burden, more particularly the 10 diseases like hypertension, diabetes, CKD, COPD, COD, mental health issues, which has 80% disease burden. We are trying to bring down those burdens with the integration of AI tools. We have enormous data available with us, you must have heard in the morning also, we have registrations of ABA, 4.96 crore ABA registrations in the state of Andhra Pradesh, and almost 11 crore 96 lakhs EHR being generated with a enormous data available with us. We can, with the integration of artificial intelligence, we can create miracles. That's what I hope. So then these kind of medtech challenge innovations and new tools will definitely help creating a ecosystem, a healthcare ecosystem, quality healthcare ecosystem, which is accessible, affordable, and scalable also in the days to come. And thank I thank all those winners for participating in this, and also the other participants for being a part of this medtech challenge. And I want more. We all together we can make efforts to build a healthy nation. Our honorable Prime Minister always keep talking about making a India a Vikasit Bharat. A Vikasit Bharat, probably if the number one or second largest economy in the world by 2047, by the time we celebrate our centenary independence. And also the Honorable CM has a dream of making Andhra Pradesh a healthy, wealthy and happy Andhra Pradesh, building Prime Minister dreams of making India a $30 trillion economy by 2047. Our CM has a vision of making Andhra Pradesh a $2.4 trillion economy in the country. But to make to make the economy, to build the economy, you need a healthy nation. A unhealthy nation cannot be productive. A unproductive society cannot create wealth. If you need to create wealth, then you keep a nation, keep society healthy. That's how we can really make that dream of making a Viksit Bharat and also a Sonnandhra dreams of both Honorable PM and CM reality. And I speak all the innovators and those who are into startups to be more creative and be more innovative, and thus you can do that. You can adopt that what do you call sense of giving back to society. You create a healthy nation that is like giving back to the society. I thank all those involved in this. I thank particularly Ratan Tata Innovation Hub for coming forward to organize such a challenge, and also our particularly our ministry, members of ministry, right from secretary to the every member who is involved in this medtech challenge, and also all the other members involved in this. A thank, and we take forward the days to come, and we are committed to building a Swarnandhra, and also we are committed to build a Viksit Bharat with the help of all people like innovators like you. Thank you. Jai Hind, Jai Bharat.
Thank you, sir, for such a wonderful summary of the whole process, as well as setting the timeline for future implementation of all scalable challenges, whatever we have selected finally through this MedTech challenge. So now we are coming to final leg of the event. This 8-month journey is going to be rectified into something bigger. So we have gone through a rigorous evaluation process from the beginning. As I mentioned in my opening remarks and welcoming address, that we have received 292 applications from various innovators. Out of 292, finally only 18 have been selected for final pilot implementation. So after 45 days of final pilot implementation in the field, in both digital sandbox and physical sandbox, so this 18 has been put to rigorous evaluation by a final evaluation committee, which consists of our committee of applied technology and health members. And we have taken a few officers who have field experience in executing such technologies and seeing the results, so they know how it is going to really bringing the result and ensuring quality healthcare service delivery to the citizens. So they were also part of this evaluation process. And as the election process, we also brought some independent observers to the process. It is not just decided by only CAT members and officials. We also took some academia, members of academia, members of some research organization from a reputed organization as an observer to the whole process. So out of this process, finally we got 3 winners from each category. Totally there are 4 categories. For each category, we have selected 2 runner-ups as the 3rd place and 2nd place, then final winner. So totally we'll have 12 winners. So what I'm going to do is I'll call each category. When I take one category, I'll call the first, the second runner-up, that is 3rd place. Then I'll call first runner-up, that is 2nd place. Then finally, with excitement, we will announce the winner of each category. So while I invite the winners, I request the winners to collect their certificates and checks from Honorable Minister. And it is only dummy check. You'll get your money credited into your bank account, so don't worry about it. Already the arrangements have been made. Already we have collected your bank account details, and which has been mapped to our CFMS system. So you'll get money credited in 2 or 3 days. So I'm assuring you the credit of the prize money. It's not a political promise. So I'm getting that as honorable minister. So when I invite the winner, so I request each winner from each category to speak about their tech, whatever pilot they have done for 2 minutes. Please give a brief experience of going through this process just for 2 minutes. That means for each category, we will request the top winner to share their experience of going through this process for 2 minutes. Only the top winner, the first place holder. So with this, we are coming to the announcement of the prize winners. So the first category. So the first, there are 4 categories. The first category is category 1, AI powered diagnostic tools. Second category is category B, portable point of care testing. Category C, third category is smart monitoring and wearables. The last category, category D, is remote care and telemedicine. So these are the 4 categories under which we have selected these 18 finalists. So for each category, I'll just read out the winners. So I request each winner please come forward quickly. I think all 18 people are here nearby. So please try to come through faster and collect the prizes from Honorable Health Minister. So I request Honorable Health Minister to hand over the prizes. So the first category, AI-powered diagnostic tools. The second runner is third place, Sunfox Technologies Private Limited for heart attack management and AI cardiac diagnosis. I request K. Apu Gupta or their representative from Sunfox Technologies Private Limited for heart attack management and AI cardiac diagnosis. Again, you can go. Okay. So we congratulate Sunfox Technologies Private Limited for getting third place in AI-powered diagnostic tools. So I request Honorable Health Minister to hand over the prize check as well as the participation certificate. So I request other dignitaries on the dais to join Honorable Health Minister to hand over the prizes. Thank you. Congratulations to Sunfox Technologies. Second place, Cognitive Biotech Technologies Private Limited for digital therapeutics for early childhood neurodevelopment. So I request Sri Hani Agarwal, Chief Business Officer from Cognitive Biotech Technologies Private Limited for the computer technology, digital therapeutics for early childhood neurodevelopment. Congratulations to Cognitive Biotech Technologies Private Limited. I request Honorable Health Minister and the dignitaries on the dais to hand over the prize. The first prize goes to Southwick Technologies for their excellent initiative of Swasa AI, which is a respiratory screening platform. The AI-based respiratory screening platform, it is called Swasa AI. So I request its founder and CTO, Sri Narayana Sripada from Southwick Technologies and their team members. Please collect the prize from the Honorable Health Minister and the dignitaries. I congratulate Southwick Technologies and their team for getting first prize in category AI for diagnostic tools. The second category, portable point of care testing. The third prize goes to Couple Technologies Private Limited for early detection of anemia, leukemia using AI 100. I request Dr. Leela Manohar Reddy from Couple Technologies Private Limited for collecting the prizes and certificates from Honorable Health Minister and the dignitaries on the dais. So I congratulate Couple Technologies Private Limited for early detection of anemia and leukemia using AI. The second place goes to clinical technology. The second place goes to clinical technology for smart for CX for cervical cancer clinic. I invite the team members and representatives from clinical technology for collecting the prizes from Honorable Health Minister and the dignitaries. Congratulations to clinical technology. Sri Kedar, Sunil Hariyomkar and team from clinical technology for collecting the prize from Honorable Health Minister. Congratulations to the team. The first prize under the category of portable point of care testing goes to Remedio Innovative Solutions Private Limited for a comprehensive eye training solution. Remedio Innovative Solutions Private Limited for comprehensive eye training solutions. I invite Sri Anand Sivaraman, Chief Executive Officer of Remedio Innovative Solutions for comprehensive eye training solutions. So they are collecting the prize money from Honorable Health Minister. The first prize is 5 lakh rupees, second prize is 3 lakh rupees, and third prize is 2 lakh rupees. Totally 10 lakh rupees for each category. And coming to third category, smart monitoring and wearables. The third place goes to Cardio Nectar Plus Health Solutions Private Limited for Ally Clinical Decision Support System. So I requested Ms. Deepshika Mishra. Deepshika Mishra. Mr. Deepshika Mishra, Program Lead for Cardio Medcare Plus Health Solutions Private Limited. Mr. Bharat, okay, name given by your company is Mishra. Okay, I congratulate Dr. Bharat for collecting prize money and certificate from Honorable Health Minister for Allied Clinical Decision Support System. I request all the participants to give a big round of applause. We should congratulate each and every winner. The second place goes to In-Axle Technologies for science and infrastructure independent neonatal respiratory support device for hospital and transport use. In-Axle Technology. I think Sri Nitesh Kumar Jangir, the founder of the technology, is here. We congratulate Nitesh Kumar Jangir. Please clap. We should give a big round of applause for the winners. We should motivate them, we should congratulate them, we should appreciate them. So your class is going to really motivate them to innovate further. The first prize under category of smart monitoring wearables goes to Care NX Innovation Private Limited. Care NX Innovation Private Limited for improving neonatal outcomes with AI and digital fetal monitoring group tracking. I request Mr. Sachin Tarashar, the Vice President of Care NX Innovation Private Limited, is collecting the prize money and certificate from Honorable Health Minister and the dignitaries. I request all the participants, please motivate them, congratulate them, appreciate them by putting your hands together. Please motivate each and every one of the winners. So the last category, remote care and telemedicine, in which the third place goes to Deep Fact Private Limited for Pro Rhythm, the remote patient monitoring solution. Pro Rhythm. It is a remote patient monitoring solution represented by Chief Executive Officer Mr. Vamsi Karata. The third prize goes to Deep Fact Private Limited. As the Honorable Health Minister agreed to hand out the prize. I ask all the audience, please encourage them. Thank you, Mr. Vamsi Karata and the team Deep Fact. The second prize goes to Viva Med Data Private Limited. Viva Med Data Private Limited for AI. It's an integrated AI-enabled cervical cancer screening. It's a wonderful initiative by Viva Med Data Private Limited, represented by Mr. Adarsh Reddy. We congratulate Viva Med Data Private Limited. Thank you, Honorable Health Minister and the dignitaries to hand out the certificate. First place goes to the last category. The first place goes to Rejuven Medicare India Private Limited for empowering healthcare at any point of time. We appreciate the efforts of Rejuven Medicare India Private Limited. The other participants, we would like to hand over the certificate of participation to the participants. So from the first category, I request product or for IAS Bangalore. Or for IAS Bangalore, Mr. Raunak Pradhan. I request or for IAS Bangalore for integrated data model and insight platform early dengue outbreak and detection and public health decision support. Next category, I request Primary Health Tech Private Limited, represented by Mritu Paban Deka, for mobile lab, portable AI blood testing device, Primary Healthcare Private Limited. Another participated in the same category, Fuel Life Sciences. Fuel Life Sciences, Mr. Shishir Kumar, for POCT and artificial fit for diagnostics. I request Rural Life Sciences representative to come and collect this certificate. Okay, next category. Short-term Lab Private Limited. Maitrey Kondapi. So I request Short-term Lab Private Limited to come and collect this special certificate from Honorable Health Minister for wearable device PC. Application is joint health diagnostics, post anemia, muscle wasting, and neurological health. I request genetics technology. I request genetics technology represented by Dr. for AI-powered clinical intelligence platform for digital health, interoperability, and precision care. This particular category has tough competition, very tough competition. Almost everyone has got almost similar marks, only in a fraction of marks they got these three prizes. All were very good initiatives. They have shown wonderful effort, wonderful results in implementation of their pilot. All were actually very good, but because of fraction of marks, they would not get a first and second place. Otherwise, they are wonderful initiatives. Next participant, Monero AI Private Limited. Monero AI Private Limited for the category of remote care and telemedicine. I expect Rohit Bharawa. Rohit Bharawa to come and collect this participation certificate. I request you to occupy the seat, sir. So now I request the top winners to come and share your experiences. So first I invite Salsi Technologies, Sri Narayan Rao Sripada, from the category of AI powered diagnostic tools. I request Sri Narayan Rao Sripada. Please share your experience for 2 minutes about the journey, about the technology, about the initiative. You can stay there. You can stay there in the corner. That will be better. Next winner also should be ready.
Good evening, everyone.
Yeah, please.
Good evening, everyone. We have a product called Swasa, which is primarily used for screening and triaging of respiratory diseases. All that what we need is a mobile phone. The patient has to take a breath and cough into the mobile phone. Based on that, we will try to detect whether there is any abnormality and if it is there is a chance of having pulmonary tuberculosis, COPD, or asthma. So it's very easy to use. Even a health worker can go and do the screening at the village and at in the house itself. For that matter, even the citizen himself or herself can also do the testing. Self-testing also is possible using our device. So as part of this pilot, we actually screened about 8,000 people in East Godavari district, Rajahmundry, and in two PHCs covering about 28 sub-centers. We did this screening, and 40 health workers actively participated in doing the screening. In a day, on an average, we screened about 225 people. And out of those 8,000 people who we screened, we detected that there is a chance of having pulmonary tuberculosis risk for about 10% of those population. And those 10% people are subjected for the NAT testing at the laboratory facility which is available at the PHC. And out of those people who really went for the NAT testing, 11 people got detected with pulmonary tuberculosis. And out of those 11 people who got detected with pulmonary tuberculosis, 36% of them are asymptomatic. They don't have any symptoms, and that's really the advantage of our tool. In a traditional ACF-based screening, you definitely would have missed out those cases. That's one thing. And the second thing is the people who got detected, they are actually, 50% of them are more than 50 years of age, and 60% of them are women, which means that people who really are not in a position to come to the healthcare system. This technology really helped in detecting those cases because the health worker went to the home and actually did the screening. So altogether, it's a very highly satisfying project, and thanks to the AP government. And more importantly, wholeheartedly wanted to thank Dr. Vashundhara, who is the DLA at Rajahmundry, and who really helped in making this project successful. Her leadership was outstanding.
Thank you, Sri Narayan. Next is Remedio, Sri Anand Sri Shivaraman, CEO of Remedio Innovative Solutions Private Limited.
Thank you so much. So the solution we have is one where we ask the question, can we take a picture of the retina and look at both eye diseases and systemic diseases? As part of the pilot, we actually ran a session where we had health workers that were screening for all diseases of the eye, including cataract, refractive error, retinal diseases, as well as looking at whether we could identify those with diabetes that have complications due to diabetes, like diabetic retinopathy. What was really nice was the enthusiasm with which the health workers received the pilot and were able to use the devices. And I think what is nice in this framework is for the first time we have a case where it's a structured process where the AP government has been able to identify technologies, go through a pilot, and actually be the first users of the technology. I believe that in public health, government being the first customers is a big lift for all of us as innovators. And I sincerely thank the initiative as well as the vision behind this. Looking forward to seeing how we are able to add to the 16 million that we've impacted so far. We have a target of getting to 50 million in the next 4 years, and looking forward to that.
Thank you, Sri Anand.
So this was in Guntur with Dr. Banishri as nodal officer and Dr. Rambabu with at Guntur Medical College.
I request Care and Next Innovations Private Limited representative, Sri Sachin Parashar.
First of all, thank you so much. And the pilot was done at KGH Hospital, Visakhapatnam, and Victoria Hospital.